Thank you, Honourable Member. Are there any members wishing to speak under 29(2)A? Seeing none, I will recognize the Honourable Member for Vermilion-Lloydminster, followed by the Honourable Member for Calgary-Mackenzie-North.
Thank you, Madam Speaker. It's my pleasure to rise and speak to Bill 26. And I'd like to thank the Honourable Minister for bringing forward this piece of legislation. I think that it is always important that as legislators we look to do what needs to be done to take care of the most vulnerable in society. And I'm pleased to note that the legislation extends beyond just the soon-to-be renamed Assured Income for the Severely Handicapped. I'm glad to hear that that name is going to be altered. I think that it's important that the language we use is appropriate and that the language we use when we're working with and working cooperatively with those who require assistance from government, that it be done in a compassionate way. I'd also like to thank the Minister for listing off many of the advocates that worked with him and his department in creating this legislation. I note, in fact, that he included the names of some people who have been very critical of him and his department, and I appreciate that, Minister. I think it's important that we listen to critical voices and we acknowledge that they also add to the conversation. So I think that's very healthy. I want to give a little bit of background perspective from my own perspective on this file, both as a representative MLA, but also as a member of the previous government. I will tell you, Madam Speaker, that one of the initiatives and one of the measures that was taken by former Premier Alison Redford that I frankly think is one of her shining moments was when she increased the age benefit in the 2012 budget from amount by $400, from $1,188 per month to $1,588 per month. And you know, there's a lot said about previous premiers, and there's a lot said about previous ministers and certain portfolios and that sort of thing. And hindsight, of course, was always 20/20. But I will say that having just joined the government around the time that the 2012 budget was put in place, and there was a lot of criticism of that budget from the official opposition of the day. I will say that this was a measure that certainly I heartily supported. And to give you just some perspective, that increase to $1,588 was a $400 increase from the previous rate, which had last been adjusted in April of 2009. There had been a 3-year time period where there had been no adjustment. And if there's one thing that this piece of legislation finally does address, and that is that there has not been an adjustment to the age benefit since 2012. It has been frozen at $1,588. And I fully acknowledge that it was the party that I was part of, the government that I was part of, that made no adjustment for the first 3 years, but it was the current government that made no adjustment for the next 3 years. And so I'm glad that this legislation makes an attempt to address that 6-year time period, or really it'll be 7 years by the time that the actual increase takes effect. But that the increase in amount over that period of time is actually only about half of what it should be. And I will provide some evidence to that, and I will also be providing an amendment in committee stage that actually recommends that the basic age benefit be increased by more than what the current legislation calls for. Because I believe that if we're really trying to make sure that recipients are keeping up with inflation, which indexing it to CPI correctly does going forward, then we shouldn't lock in the fact that over the last 6 years there has been no adjustment. And if we only increase it by $97, which is what the current legislation provides for, we are locking in the fact that we won't have the benefit correctly adjusted. I think there are a few other things that we do need to look at when we're looking at this legislation. One of the concerns I have expressed to me on a regular basis by constituents is that disability pension benefits are clawed back. So if there is someone who contributed to a disability pension or a disability plan and was receiving a benefit from that plan, that is used to then reduce the amount of their AISH benefit. I'm not sure that that's entirely fair. If, at the time that they were working or at the time that they were involved in employment, if they contributed to a disability plan, they clearly will receive that benefit, but why that should then be turned around and clawed back from their AISH benefit, certainly that's something I have a great deal of difficulty explaining to my constituents that raise that as a concern. And, I would appreciate, having that discussion perhaps at committee level, or perhaps the minister can address it during his comments on the closing of debate on second reading. Another area that I will address today as well with regards to Bill 26, and it perhaps doesn't have to show up in the legislation, but I think it is something we should very much at least look at, and I know that the minister is very aware of this issue, and that is an increasing number of recipients of AISH benefits are benefited greatly by the ownership of service dogs. And we saw that even as recently, now this is a different health situation, but on Tuesday evening we saw, the incredible situation where I met a service dog that was trained to detect high and low blood sugars. I mean, if you want to talk about an amazing level of training, to be able to train a dog to be able to detect high and low blood sugars for diabetes patients. But having a dog like that, I will tell you, Madam Speaker, is not an inexpensive proposition. The initial training and acquisition of such a dog and then the care of a dog like that is, not an inexpensive proposition. And for many of our handicapped, or for many of our recipients of benefits, I'm going to avoid that use of that word handicapped. For many of those recipients, the service dog is an absolutely vital and critical part of their lives. And that's whether that service dog assists them with a specific physical handicap, or whether it assists them with PTSD, or whether it assists them in some other way. And these dogs are as vital to them as medication. They are as vital to them for companionship and for a number of other ways. And I'm sure the minister knows where I'm heading with this. And again, this is through some of my conversations with Mr. Les Landry that he acknowledged in his opening remarks. These dogs are critical. And just as our recipients of these benefits should not have to choose between purchasing personal hygiene items and food, or paying their rent, or paying their utilities, they certainly shouldn't have to make decisions with regards to how they care for these service dogs. They have to be fed, they have to have veterinary care, there are costs involved in pet ownership. And these dogs are not just pets, these dogs are vitally important. So I'd like to see, and if it's not done in the course of the legislation, then certainly in the course of the regulations flowing out of the legislation, some provision for an allowance for those AISH recipients who have service dogs to assist them with whatever situation that they are in. I think we have to look, as I said, at pension, at the disability, or rather at the disability insurance premium, or the payouts, and how those are clawed back. And I will raise some of these in the course of debate in committee stage. But I do want to say that this is a positive matter, and I do think that the indexing of these benefits, not just benefits under the AISH program, but other benefits, indexing them to inflation is the right thing to do. It means that for people who require the assistance and are dependent on that assistance, that they are not going to be in a situation where even when our finances are challenged, we say, look, we just simply can't afford it. That was the answer that AISH recipients received for 3 years from the government I was part of. That's the answer they've received for 3 years from this government. And I think we can both share in the acknowledgement that that answer quite simply isn't good enough. So I will be happy to support Bill 26. I will be bringing forward some amendments that I think would improve Bill 26, and I'm certainly hopeful that the minister will consider them favorably. But in the meantime, I think it is important that we as a legislature, and that we as a society indeed, recognize that it is our obligation to make sure that the most vulnerable in our society are taken care of, that the most vulnerable in our society do not get left behind. And, I speak of, in terms of my own personal approach to the things that I deal with, whether it was in my business practice or whether it was just as a community member or whether it was chairing our health foundation or my involvement in the Rotary Club. It was always a chance to look for those folks that otherwise might get left behind. We live in a prosperous and caring society, Madam Speaker, and there is absolutely no reason why people should get left behind or people should not be cared for. And I know that there are instances where that happens. And I think, quite frankly, that those are the instances that we should try to root out and eliminate in as many ways as we can. I think Bill 26 is part of that, and I will be happy to support it. Thank you, Madam Speaker.